For many of you, you know that I talked to you about your tumor markers. For many of you, you know that your tumor marker is measured when you have blood tests. For many of you, you know that your moments of joy and your moments of distress comes because of the tumor marker result. I don't know that I'm going to be able to say anything that's going to change your attitude, but I just want to put it into perspective because I know I say this to you individually, so I'm going to say it to you as a group. So first of all, what is a breast cancer tumor marker? So this is a cartoon picture of a cancer cell in the process of mitosis, and it has little proteins on its surface. So the tumor marker that we use in Australia is a little protein that sits on the surface of the cancer. To date, we don't think it does anything. So it's not like my molecular biology slide where I say a protein on the surface gets excited and causes your cancer cell to grow. This protein does not. It is a bystander protein. It's actually called a muck protein. And what it does is it sits on the cell of some women with breast cancer and it gets dislodged. Now, why does it get dislodged? Well, it might get dislodged because there's just so many cancer cells growing and growing. They jostle each other and release a lot of this protein into the blood, so your levels might go up. It might be that the treatment that you're on is actively killing the cancer. So in the process of killing the cancer, these little protein molecules get released into the bloodstream. So that's what I tell you when I tell you you've got a tumor flare. I think the drugs are working. The fact that your tumor marker's gone up doesn't alarm me. This is a protein, and it's not a unique protein. So almost every single individual will have other proteins in your blood that the laboratory, no matter which laboratory it is, will pick up another protein in your blood that looks like this CA15-3 and tells you that your tumor marker is going up. So that's a false elevation of a tumor marker. And there's no way really of measuring that protein separately to this protein. Can it harm you? One molecule of CA15-3 has been best measured as 0.26 angstrom. That's another unit of measure. How much is an angstrom? 10 million angstrom are needed to make 1 millimeter, which is that. So this CA15-3 protein is tiny, it doesn't harm you, and no matter how high the level gets, it will not be a danger. And my highest level is 653,000. So, no, it has no harmful effect. Are higher levels dangerous? No. Can it be measured in every breast cancer patient? It's rarely elevated in early breast cancer, and it can vary from 30 to 80% in metastatic breast cancer patients. And there are certainly instances where if you've got a bit of a chest infection, and sometimes if you have a little bit of diarrhea, that inflammatory process sometimes can make your CA15-3 go up. So the take-home message is if you have a tumor that produces a tumor protein that can be measured, by all means know about it, but please, please, please don't let your sense of happiness or despair be affected by what the level is. And probably the most important thing is that the trend of the tumor protein is what helps an oncologist make a decision. On its own, it should never dictate a change in your treatment. And sadly, I've seen a few ladies where that's been done. They've been on a treatment, 8 weeks later, the tumor went up, so they had their treatment change. 8 weeks later, the tumor went up, they had their treatment change. And that's really, really a bad thing to do. Questions? Because it's a trend. It helps with the trend. It's just the trend. So, I mean, unless a patient of mine has a tumor marker that's, 54, 56, 72, 69, 3,420, I'll take note of that tumor marker. I will never change treatment because of that, but I will chase it. If I can't feel it, if I can't find where I think it's coming from by talking to the patient, I will scan. So that kind of, and it's rare that that ever happens, but a very pronounced elevation in the tumor marker can be valuable information. But it's the trend that I use.